sure. This one's about a year, 3 months, and this one's about a year.
Alright. For how long do you have them?
I've had them for about 6 months.
Yeah.
Oh. Have you noticed any issues with them, like runny tummy, like
No, nothing.
any coughing, sneezing?
No.
Okay. So basically, no concerns regarding them. Okay. So today we'll admit them and we'll do the procedure. The procedure is under full general anesthetic.
Yep.
And that will means we'll need to knock them down. Any kind of general anesthetic is coming with some risks. Yeah. But accordingly with the drugs used, the care provided, the risks are minimal.
Yep.
We didn't have any kind of issues with anesthetic yet, so the drugs are pretty safe. We have the option to reverse the anesthetic in case we are seeing any kind of problems during the procedure. In first instance, we'll need to check up their body weight. Yeah. And for this, I will need to have them out from the care one. Doesn't matter.
Good boy.
Good boy, Snipes.
He's got lovely eyes.
Yeah.
I'm gonna wait for him to turn around.
Can't have a smoky without Bandit.
A little bit like
378. Okay.
God knows how he eats more.
slightly smaller frame.
Yeah.
He's not microchipped. We'll sort it out today as well.
You're going to have a chip as well, mister.
The deal.
Bandit. He's a good boy.
So, Vicky, you are a registered nurse. So, tell us the importance of being a registered nurse. You studied for a while.
Yes.
Yeah, and you're different from a normal nurse.
Yeah, absolutely. So 3 years of training, lots and lots of exams and learning and experience along the way, and lots more things that I can do that care assistants and things can't as well, for sure.
So you've got two patients today.
We do indeed. Yeah,
And
we
they're
have the lovely
cats.
Smokey and Bandy here today.
Okay.
They are beautiful boys and they're coming in to take advantage of our cat castration promotion. So at the moment we're offering a neutering promotion.
And so how long is this procedure going to take?
It's a very, very quick procedure. The castration itself, from the sedation, the procedure and the reverter medication to wake them back up again, it's around 1 hour in total. But the boys will be nice and comfortable, they'll be having sufficient pain relief and lots of love and attention afterwards as well.
And doctor, you are this Dr. Vlad, very experienced. So a lot of people don't understand the importance, when they've got a male, it's not their problem if the male gets out and, is breeding with, loads of other females. But there are STDs, correct, that cats can get.
Yeah, it's very important to have a control of everything happening around us. Leaving the males undone can generate undesired kittens in that specific case, which can become a reservoir for every single kind of diseases, parasites, and so. It's very important to be done also because some of them, like those two, are indoor cats only, which doesn't have outdoor access. That means they won't gonna find a female to mate with. And an intense hormonal activity, which can be triggered by a female which is living a couple of miles away, can trigger the hormonal activity. An intense hormonal activity can lead to some behavioral changes and also can lead to some pathological changes in time. So that's the importance of the procedure. The procedure itself probably takes about 10 minutes. We have options to reverse the anesthetic in case we are seeing any kind of issues with the drugs, and basically it's making that procedure very safe.
Wonderful. So, for people that have dropped their cats, we say it's fast. So how quickly can the cats go home? If I drop my cat, in the morning, typically how quickly would it be?
Usually we are preferring to keep the cats in here for at least half day, to have a smooth process, to let them get used with the environment, to reduce the stress levels, which can be induced by the way into the practice, by the fact that they've been take it out from their normal environment, which can increase the cortisol levels in their bodies, generating some stress. Leaving them into the kennels for about let's say half hour, 1 hour will reduce the stress levels, and also after the procedure we need a recovery time for us to be 100% sure when they're going home they're fully safe.
Wonderful.
So, roughly speaking, it's about half day, but in some circumstances, some individual cases, basically they can stay with us just for 1.5 hours.
That will be quite important for some people that are traveling from a long way. They want to hang around. So what we're saying, doctor, is wherever possible, we can work within an hour to an hour and a half, but typically,
flexible, but we prefer to do our job properly. With the main interest being the inpatient safety.
Excellent. So one of the things that we didn't talk about is people have got cats. They don't realize that an uncastrated cat scents a lot. It's a type of odor that creates a very pungent smell all around the house. So the castration, will that reduce the pungency?
Absolutely, because that smell of their urine is induced by the pheromones and the hormones. So while they are done, either are females or males, the hormonal activity will be reduced at maximum, not in full, because part of the hormones are generated by the brain, not by the genital parts, but the behavior and also that kind of metabolic changes will take place after the procedure. Will take time. It's not immediately, just because part of that hormones, certain amount of hormones is already released into the body, and the body needs time to metabolize everything and to release everything. Another question that many people have is this. I've been a neighbor to people that have cats that are just calling all the time. They're really calling. It's almost like a scream when they're in season, trying to attract other cats. And this is very frustrating. It's not only frustrating for the homeowner, it's frustrating for neighbors, it's frustrating for the cat. So I would like to know that once a spay has been done, does that stop the desire and that crazy calling? Yes, indeed. Everything from what you've said will be stopped, or at least maximally reduced. So everything will be much more comfortable, not only for the pets, but for the owners and the rest of the people around. It makes a lot of sense. We will share some data on the number of feral cats, the number of kittens that have ended up in various shelters. And it's, sometimes the knowledge is so important. If you love animals, you don't want to be responsible just by accident. Responsible for creating more lives that ultimately are going to suffer. So wish these two cats the best of luck, and we will show you their process shortly. The qualified RVNs. I'm a big fan of them. So really important, especially when we're offering a promotion. What we want is still to build value. And one of the most important things about having qualified nurses like Vicky is their medical skill set. So, before we get ready for surgery, what is your typical process?
So I will be preparing everything with regards to getting the equipment and any instruments necessary for the vet to proceed. I will be drawing up any anaesthetic medication that the vet has requested with the specific amounts given. So you can see here we have a combination of 3 drugs. This is a triple combination, and essentially you're going to give it all three of these as one dose together, and this will sedate the cat. He will then be maintained on our anaesthetic machine where we provide oxygen throughout the whole process, and if necessary a little bit of isoflurane, which is the anaesthetic gas. We also have here our medication to reverse one of these anaesthetic drugs, and of course our pain relief and anti-inflammatory injection here, which lasts for 24 hours. Okay, so here we have Bandit. He has had his anaesthetic sedation drug now. So as you can see, he's nice and sedated, nice and relaxed, and we're just going to lubricate his eyes first of all, as they can dry out, of course, as they can't blink or have any kind of response there. So we just need to make sure they're nice and lubricated regularly to avoid any kind of damage or dryness or even corneal ulcers if masks and things can rub against them. So you need to be very careful of the eyes. I'm just going to pop them on some masked oxygen at the minute. Some oxygen's on. So now we are just going to clip the surgical area here. Okay, so we're just clipping the surgical site now. So we clip away all the fur to make a nice area to surgically scrub, so that we can assure that all of the germs are free for when the incision is made. Okay, so now we're just going to scrub the area using a Hibi Scrub solution, which is an antiseptic antimicrobial wash. Just going to make sure it's thoroughly cleaned and aseptic, ready for the vet to proceed. Okay, so what are we about to do here then?
So first of all, I'm just going to scan here and make sure that there's no microchip already present before I go and insert a new one. We did scan him in consult, but there was no microchip. No tag. No tag found. This is a new microchip we're going to insert today. It's quite a big needle, but the bonus of doing it while they're having a procedure is that they just don't feel it at all. So what I do is I'm just going to temp the loose skin above the shoulder blades and go dorsal. And what I like to do is hold on to the end of the chip as I'm inserting, to make sure that it stays in there. So as I pull out, I can feel that chip.
Perfect.
Inside.
So microchipping is now actually a legal requirement in cats, isn't it?
It is, yeah. It's quite a new law, so every cat must be microchipped.
Yeah.
Now, so
There we go. So he is now microchipped, which we will proceed to register on reception at the end.
So one incision to express both testicles.
So you just go down the middle.
Yes.
And how many layers are there?
Are several layers, and I will perform an open castrate. So basically I'm cutting all the layers to express the testicle. Now dividing everything. And detaching the epididymium to be able to perform a self-ligated type of castrate. So that means we won't gonna need any kind of suture material in here, which will allow a faster recovery, will reduce to zero the risks of any kind of
Rejection.
reaction of the suture material.
So you're just tying that off.
Yes, exactly.
It's incredible. Such a quick and easy procedure for male cats.
Not a very invasive type of procedure.
Not very invasive.
Yeah.
More invasive in dogs.
And also in females as well.
Yeah.
No matter what species is female.
It's one.
One side.
And that's him done. How's he doing up that end, Vicky?
Absolutely fine. He's doing very, very.
All sorted.
And that's the end of that procedure.
Thank you so much. You've picked your cats up. How was the service?
Yeah, really good actually. Everyone's lovely.
Excellent. Cats doing well. And girls, you saw the farm animals.
Yeah.
What was your favourite?
The bunny.
The bunnies.
We're not having none.
Lovely jubbly. Well, we look forward to seeing you again as a family.
Yep.
Please recommend us if you can.
We will be back.
All right, and you take care.
All right,
we'll get
brilliant.
your eggs for you in just a minute, okay?
Right, thank
Bye.
you.
Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.